Good evening, everyone. Welcome to this first session of the year. And so glad to have so many of you find time to come over to attend this topic. Although this topic has been done last year, we also know that is some freshness that we can revise ourselves, especially if you are into a deeper understanding, listening to it a few more times, that's really help. And at the end of the day, after we learn from Mr. Lee, he need no introduction, I hope. For some of you, I'm not sure whether first time here or what, because your Zoom is not on.
Today's topic is on indigestion. Basically, indigestion is one of the most common digestive complaints worldwide, affecting people across all ages. In fact, 20 to 30% of adults are affected by indigestion in the reports, in the WHO report itself, right? So, okay, without further ado, let's start. All right, what is indigestion? Right, so technically, the term of indigestion is called dyspepsia. All right, so indigestion refers to discomfort or pain in the upper abdomen, often occurring after meals. Right? What are the common symptoms? Some of them include burning in the stomach or upper abdomen. This is probably one of the typical symptoms of talking about indigestion, where your discomfort is in the upper abdomen, right? So abdominal pain or discomfort is a common symptoms and reflections of you have a problem in the gastric side itself. So other symptoms like bloating, blanching and excess gas, nausea or occasional vomiting. This is a bit less prevalent, right? And also for some, you might have acidic or sour taste in the mouth, and your stomach have a growling sound. All right. So you look at the symptom frequency here, you'll find that, in fact, blanching and bloating is very common, and in fact, postprandial fullness, whereby basically after eating you feel stomach is full. Right? Is actually very common as part of the symptom for indigestion. Okay, let's look at some of the means. Common means about indigestion itself. First, indigestion only happens if you eat spicy food. Well, these are the means. I will explain why. And it's always caused by overeating, which is not really true. Indigestion, if you understand, is actually not necessarily caused by overeating. In fact, there are a lot of other reasons that can cause indigestion. Antacid cure indigestion permanently. Anti-acid medications itself does not really cure indigestion. Basically, it's only relieve the symptom temporarily. And indigestion is harmless and never serious. And this is also not true, because there are certain conditions whereby the indigestion might signify some underlying condition and complication that need medical attention. So, okay, what are the facts about it? First of all, indigestion can occur even without overeating. Stress, certain medicines, and infections are recognized triggers. So, not all indigestion is caused by excess acid. This is a common mean. The people think the indigestion because of acid, too much of acid. Changing in stomach motility and sensitivity also contribute itself, which means your stomach's movement and your stomach's response to food also actually contribute to that itself. So persistent or worsening indigestion can occasionally signal serious condition such as ulcer or gastric cancer, in fact, and therefore it should be assessed. And this is actually very important for us to know. And in this session, I will share with everybody what are the red flags signal, whereby that when you have this type of warning sign, then you should seek medical attention. Don't self-medicate. All right. Sustainable lifestyle changes like diet, alcohol, moderation, and smoking cessation are often more beneficial than relying on short-term symptom remedies in medication. So I will also explain that as we go along. Okay, how common is indigestion itself? Well, the prevalence rate worldwide is about 20 to 30% of adults. Right? So it's quite prevalent. In fact, if you look at it itself, 1 in 4, 1 in 3 and 1 in 4 of us adult will suffer some form of indigestion symptom itself, right? So if you look at this chart here actually compare all the gastrointestinal disorder, which include our indigestion, and then functional heartburn. Actually, functional heartburn is actually one of the symptoms of indigestion. But then in this study, basically they classify it as one category. And you look at it compared with constipation and GERD. GERD actually is our commonly known acid reflux, which is an organic form of indigestion, which I will explain later. IBS, the same thing. Both GERD and IBS fall under the broad category of indigestion, right? But they are the organic form of indigestion, whereas functional heartburn is our functional form, which means that indigestion that is without a specific disease, underlying disease cause itself. If you look at this chart itself, you can see that actually the prevalence of actually indigestion is very high among the study. And in fact, at some cases, it can up to 40% in this case. You look at it itself. So it is a very common digestive problem that we all face. But unfortunately, there's no one-size-fits-all solution. We have to understand the causes of it, the factor that can affect it, and at the same time, in order to deal with it, we actually really have to understand, know how to differentiate different types of indigestion so that we know how to deal with it with an appropriate solution. Okay, now how prevalence in Asia, all right? Here is a study in here that indicate that the prevalence of indigestion in Asia range about 7 to 45%. You can see that depending on the reference, that means that the criteria you use to what they call judge indigestion itself. So in Singapore, for instance, if you use the Rome 3 criteria to assess to determine indigestion, then Singapore actually have a very high prevalence rate itself, right? 1 in 3 persons suffer from some form of indigestion. Whereas if you look at it itself, Taiwan is also equally high, and China is equally high. Now, the Japan and Korea are actually on the slightly lower side in compared with the ASEAN country. Now, if you ask about Australia, there are varying statistics, but the range is between 20 to 30% as well. Some studies have said that it's about 15%, but some study in fact it can up to 30%. But nevertheless, it's about 20% on average for most of the country, and that means that it's very common even in Asia and Australia itself. Okay, now let's first, very important, start by recognizing how to differentiate indigestion. What are the types of indigestion? So we can actually divide or classify the indigestion into two types itself. You can see from here in this circle, a group which is called functional dyspepsia, which is actually indigestion without underlying condition. So this is a condition that is not able to determine. This is called functional dyspepsia. Then we have a group which is called organic dyspepsia, which is actually indigestion that's caused by diseases itself, about underlying conditions. So like GERD, peptic ulcer, these are actually examples of organic dyspepsia. first part. Then we have what we call uninvestigated dyspepsia. Basically, they are group that have a symptom but uninvestigated. No? So this is how we normally classify the indigestion. And between the functional indigestion, you will notice that there is two subgroup, subcategory. One is actually based on the symptoms of pain. One is based on after eating meal, you find that you feel fullness itself. These two have its relevance in clinical context because by differentiating further, we will know what are the right solution we can deal with on the type of dyspepsia. Okay, let's look at how to differentiate between functional and organic dyspepsia. Now, this is very important. I think this is the first thing that we need to learn is that for indigestion, we must learn to differentiate between a functional indigestion and organic indigestion. For functional indigestion, basically doesn't have a structural disease or stand upon investigation. That means that it doesn't have an underlying cause. We know there's no known underlying cause. And the symptoms of this group often is chronic and fluctuating. That means the symptoms are not persistent and not getting worse, but it's fluctuating itself. And typically, for this group of dyspepsia, it doesn't have any alarm feature. Alarm features is like sudden weight loss, unintentional weight loss, anemic conditions, and so on and so forth, which I will discuss and explain later. So, for this group of dyspepsia, the very important part is that the treatment are very different from the organic part. The treatment on functional indigestion is focused on the diet, lifestyle, and symptom-directed medication. So we must understand. So this is the first real differentiation that anyone who have indigestion should recognize. Now you must know whether the indigestion fall into a category of functional or is it due to some underlying condition. All right. For organic indigestion, basically is caused by underlying diseases such as peptic ulcer, gastric reflux, or malignancy like a cancer or systemic illness itself, right? And the symptoms can be more severe and progressively getting worse. This is the first differentiation of symptom. And alarm features are more likely to be present, like weight loss, anemia, and there's a lot of other features that I will explain later, all right? So the treatment for this group are very important is to target against the underlying diseases itself. So therefore, the application of the medication as well as the treatment protocol are very different from the functional side. Okay, now let's start with the functional indigestion, right? What is functional indigestion? Actually, the underlying cause of functional indigestion is because of a gut-brain disorder problem. Because the disorder of the gut-brain interaction itself causing that the indigestion symptoms itself. So what are the, you can see from this chart itself, basically the problem is of nothing to do with any diseases, but there is a communication problem between the brain and your gut system. So this communication itself is actually having a problem, having a disorder, and therefore it can contribute to actually the symptoms of what we call indigestion itself. Also, other causes like normal gastric motility or delay emptying can also resulting in the functional dyspepsia, right? Also, another one is increased sensitivity to normal stimuli of your actually your gastric system. The GI system itself also can contribute to this. Also, actually, the changes in the GI microbiome, which is mucosa immunity, your membrane itself, also can actually contribute to this functional dyspepsia condition. Okay, now what are the risk factors for functional dyspepsia? And we need to know because that in fact, functional dyspepsia account for about 70% of indigestion cases itself. So this is the major category. So in fact, most of the problem of people suffering from functional dyspepsia arises from the trigger. These triggers are actually mainly due to psychological factor, because it's a brain-gut communication problem. So therefore, anything that deals with the brain itself, especially like stress, psychological stress itself, anxiety and depression, will actually trigger actually the indigestion symptom itself. So therefore, the first risk factor for people who are actually suffering from this itself actually is stress. Stress can trigger indigestion, and this is actually one of the major trigger factor for it. Other factors like lifestyle pattern, like irregular meals, eating too quickly, eating during stressful situation, or frequent overeating itself can also lead to indigestion, right? Your dietary habit, like taking in high fat, spicy, very sweet food, high caffeine, alcohol, chocolate and carbonated beverage itself also can trigger indigestion, right? Smoking and some medication, which I will discuss later, I will share with you later, can also worsen indigestion, or can also mimic having an indigestion symptom. All right. In the functional indigestion itself, we can subdivide it into two subgroups itself. The two subtypes itself, one type is actually we call the PDS, postprandial distress syndrome. So this is basically symptoms that is after eating a meal, you feel fullness and early satisfaction. So therefore, you basically say that no, I cannot eat a lot. When I eat itself straight away, my stomach is full itself. Now this is actually the PDS subtype. PDS subtype itself, the underlying causes of it itself can be two. One is actually due to the impaired gastric accommodation. This account about 40% of the functional dyspepsia cases. And then the other, what they call the mechanism that causes it is delayed gastric emptying itself, right? So this account about 30% of the functional dyspepsia patient. So if you look at it itself, the PDS subtype itself account for 70% of the functional dyspepsia type, right? Then you have another subtype, which is actually epigastric pain syndrome, where there is a predominant pain in the upper abdomen, burning, or not limited to when you're taking meals itself. So this is actually another subtype. This subtype, actually, the mechanism that causes it is due to the mucosa membrane alternation, as well as actually sensitivity, variation of sensitivity of a GI to the food, sensitivity change. So these are the lesser predominant subtype itself, right? Now each subtype, why we need to actually differentiate the subtype is because each subtype will have different medication and different lifestyle treatment, right? So you need to also understand that between the functional indigestion itself, right? Whether your indigestion is actually showing you the symptom of after eating, you feel full, or you have a symptom of actually after eating, or your symptom of upper abdominal pain. So these two are different types of subtype of it itself, and each have different treatment options. Okay, let's look at the treatment approach for the functional dyspepsia itself, right? So this chart gives you a very quick summary of how it's been treated currently, right? So of course, I say again, for the after meal PDS syndrome itself, the hallmark symptoms are early satisfied. You actually have bloating, you have upper abdominal pain, but the pain are not as same as actually the EPS subtype. So how the treat? If you will see a doctor, the doctor will basically say the first thing they'll do, they'll always go for testing for H. pylori infection. Now this is a standard, what they call the protocol that currently the treatment requires itself. But that's not important. Important thing is that if you look at it itself, the medication that apply for the PDS subtype are very different. They are actually focused on medication that affects the motility of your gastric system itself, right? And the dietary and lifestyle treatment are also very different. For this subtype whereby you eat and you feel the stomach always full easily, right? The treatment itself is that you are supposed to eat smaller, more frequent meals, right? And avoid lying down immediately after eating. These are actually the appropriate lifestyle modification that you can take. On the other hand, if you are suffering from the pain syndrome, epigastric pain syndrome itself, right, where you have heartburn, you have nausea and vomiting symptoms itself, right, the doctor's side will prescribe acid suppressant for you. Basically, the medication are very different. You can see from here. And at the same time, in terms of dietary and lifestyle treatment itself, basically you should focus on the limit the fatty, spicy, and acidic food, and reduce alcohol, caffeine, and smoking. So it's very different in terms of the approach and the solution as well, both in the drugs as well as in the lifestyle treatment side itself. But as a whole, for functional dyspepsia, right, the general self-care and lifestyle modification that apply to both first of all, you actually have to improve on your sleep habit, right? Second thing is that you must learn to manage your stress, because stress is one of the trigger for the functional dyspepsia, regardless of your subtype itself, right? And you need to actually have regular physical activity. This will help. In fact, physical activities basically help to reduce the stress itself. Also improve your overall metabolism and system itself. So these are generally well recommended for people who suffer from functional dyspepsia. Okay, now let's look at in the functional dyspepsia, one medication which is actually we call proton pump inhibitor. So this is actually a medication that's very commonly prescribed, and its function actually is to reduce the gastric acid in the stomach. It works on reducing the acid secretion in the stomach itself, right? So what common name like omeprazole and so on. I think that this I leave it for you all to see. But important thing why I want to highlight this medication is that because it is a very common first-line medication from the doctor itself, right? Now, short term, when you use a PPI, can relieve symptoms in a patient with functional dyspepsia, particularly when acidic-related complaints are prominent. It's effective in the short term. These medications are quite effective. Unfortunately, the current treatment for the functional dyspepsia have limited efficacy for present day. There are some safety issues relating to use of the proton pump inhibitor. It's a PPI medication. Now, the minor side effect of this PPI, for those who are taking it, right, itself, generally, these are the minor side effects that has been listed. They are headache, rashes, dizziness, GI symptoms, including nausea, abdominal pain, and fluctuant constipation. Very similar to what you have in a functional dyspepsia, but then these are the side effects also. Even if you try to reduce your acid secretion itself. But a more concern actually is that if you need to use PPI in long term, right? The study have actually reported long-term use have associated with reduced nutrient absorption and increased risk of respiratory and gastrointestinal infection. Now, so as far as concerned, if you are using long-term user of PPI itself, generally it's important for you to actually have regular review of your nutrient status. At the same time, also go for regular checkup itself. All right. So there are some observation study also suggest they are linked to kidney diseases and fracture and so on. Itself. Right. So in here itself, now probiotic actually stand out as a very good adjuvant and therapeutic supplement. In fact, it's not even adjuvant. It's considered a therapeutic supplement. It's because for functional dyspepsia, if you notice, because it's something that actually is not an underlying disease itself. So probiotic actually has been well studied for the treatment of functional dyspepsia, and actually has been now sort of recognized as effective supplementation for people who suffer from functional dyspepsia, right? Either you take a probiotic as monotherapy, or you add on to the long-term PPI, taking the PPI treatment. Both are also equally beneficial itself. Okay, now what other supplements for functional dyspepsia itself? Here are some of the useful supplements for people who are suffering from functional indigestion, right? Among them are the curcumin, right? Melatonin. Melatonin very commonly actually for people who actually have a sleep problem. And why? It's because very simple. It is also related to your gut-brain communication problem disorder. It's actually related to the brain itself, right? And then there's a chiosmastic gum, right? And a vitamin D. So here are the actually useful supplement for people. When you suffer from dyspepsia, you can actually try to supplement with all these supplement to help to relieve your symptom. Okay, now on the TCM side, there is actually a good TCM alternative that you can actually choose. And should you find that PPI is not giving you the results, or you have problem with taking the medication or PPI itself, well, you might want to consider taking the TCM alternative. Right? So the TCM alternative for dyspepsia, functional dyspepsia, is called Xiao Yao San. So basically, it's a formulation. It's a formulation with 1, 2, 3, 4, 5, 6, 8 herbal ingredient in there, right? It's a standard formulation. It's a Chinese medicinal formulation. So basically, it's also been studied, and it's well reported that it's effective for treatment of functional dyspepsia as an adjunct or alternative. Okay, now let's talk about the other class of dyspepsia, which is actually indigestion that's due to diseases, caused by diseases itself. So indigestion arises from identifiable medical condition. It's what we call organic dyspepsia, right? Now, such as peptide ulcer disease and gastritis, right? Often actually related to H. pylori infection or the painkiller NSAID intake. We will discuss this shortly, right? And also the very common known gastroesophageal reflux disease. In short, we call GERD itself. So, and also other diseases that can actually contribute to also to organic dyspepsia actually is the pancreatic or biliary tract diseases, gallstone, and also all the cancer of GI tracts, like pancreatic cancer, liver, bile duct, stomach cancer itself. Right now, the organic dyspepsia group itself, the symptom may resemble functional dyspepsia, but more likely to have alarm feature, like what we have mentioned earlier. What are the alarm features? Is like weight loss, vomiting, anemia, and bleeding. These are the typical alarm feature that comes together for people who suffer from organic dyspepsia. Okay, what are the common causes of dyspepsia itself? You can see from here, this chart itself, right? 73% of the dyspepsia is actually functional dyspepsia. Only less than 30% of the dyspepsia are organic dyspepsia. So among the organic dyspepsia itself, right, there are two major causes. One of them is actually the gastritis and peptic ulcer. This accounts for about 15 to 30% of the dyspepsia worldwide, right? And the other one is actually the GERD. The GERD accounts for 20 to 40% of dyspepsia worldwide. So GERD is considered the major cause of organic dyspepsia, followed by peptide ulcer itself. So let's look at the peptide ulcer first, right? Peptide ulcer and indigestion. What is peptide ulcer? You can see from here, basically peptide ulcer are open sores in the lining of stomach or small intestine. So if the sore is in the stomach, we call gastric ulcer. If it's in the small intestine, you call duodenal ulcer itself. Basically, in whole, actually, they are the ulcer in both in the intestine, in the stomach itself. Now, what are the major risk factors for peptide ulcer? First, the most major risk factor is actually the H. pylori bacteria infection. So this is the most common one. And then the second one actually is the regular or high dose use of non-steroidal anti-inflammatory drugs. We call NSAID, like aspirin, ibuprofen, and so on, ketoprofen, and so on. So these two are the main risk factor for peptide ulcer. Okay, so we talk about NSAID can contribute to peptide ulcer and resulting in indigestion itself, right? Here, I also want to take a short note to everybody, especially for all of us who are in Singapore and in Australia, I'll put it that way. In the developed country, the causes of functional dyspepsia itself have actually the medication causes of it. That means that there are a lot of medication that can actually trigger the indigestion symptom. And the more developed the country is, generally the trend of medication trigger indigestion higher. So therefore, I think you need to highlight to everyone that if you are on long-term medication, this type of medication on this list itself, you might likely to actually experience some form of indigestion symptom. And your digestion symptom could be due to your medication and not other medical condition itself. So here are other medicine that can trigger the functional dyspepsia symptom. Antibiotic itself, the key symptoms are nausea, cramping, and bloating. Estrogen, which is actually estrogen, female, the hormone. So in here, easy satiety and feeling full, fast, and sensitivity to gas. Iron pill, very common for people who are anemic condition, they supplement with iron pill, and therefore iron pill also can cause symptom of heavy epigastric pain and a metallic taste itself. So this is also one of the symptoms of what we call the functional dyspepsia. Steroids medication also can cause burning sensation, and often worse when combined with the NSAID medication. And the last but not the least is actually the thyroid medicine. Thyroid medicine actually is a very, very important class that can actually a very sensitive class. Excessive of thyroid medication when you take itself will actually cause reflux or loose stool. When you don't take enough of the medication, of thyroid medication, basically you have symptoms of fullness and bloating. So therefore, actually, it's a very sensitive medication, and it can actually trigger a lot of what I call undesired symptom in there. So take note of it itself. Also, if you are on long-term medication of this list itself, then if you are experiencing indigestion, then likely that it's not due to other causes, but rather due to the medication itself. You might want to actually suggest to a doctor if you have this symptom and persist over time. We may let doctors know and see whether the doctor can modify the medication for you. Okay, H. pylori. H. pylori is actually a bacteria, right? And it can cause peptic ulcer, right? So the H. pylori infection is very common. In fact, is reported to actually present in more than half of the world population, which means 2 in 1 of us actually will probably have H. pylori infection already affected with it itself. The bacterium usually colonize the stomach during the childhood. That means that it's in younger stage, you already get infected. And if it persists, it's a major cause of chronic gastritis and peptide ulcer disease, which is actually one of the major problem for a lot of people, especially in the Asian country itself, right? Transmission mode likely occur through close contact, saliva, stools, and possibly contaminated food or water. So in a developing country or underdeveloped country where the hygiene standards are low, this is one of the very commonly infected bacteria that's transmitted through what they call the stools and contaminated food and water. But for the Chinese in the past, the transmission to saliva are very common because of shared utensils, eating utensils itself. So therefore, actually, the practice of sharing, having a common utensil should be discontinued because there's a risk of transmission beyond just only H. pylori infection itself, right? Now, what are the common symptoms of H. pylori infection? It's actually burning stomach pain. So this is one of the most common symptoms of H. pylori infection itself. What are the complications when you suffer from peptic ulcer? Well, there is an immediate complication is that first of all, the holes itself, right, can cause bleeding. Now, bleeding itself, slow bleeding will lead to anemia, right? But if it's a fast bleeding and heavy bleeding, then you can be life-threatening, internal bleeding itself. The other complication is perforation. Perforation itself, basically, a hole in there allows other infections to have bacteria, other pathogen to go in, and therefore can cause what we call a condition called sepsis, where actually it's a systemic infection itself. And this is also a life-threatening condition itself, right? Of course, the peptic ulcer also can cause obstruction, scarring, or swelling around the ulcer, also narrow the outlet of the stomach and causing vomiting and weight loss itself. So these are the complications of peptic ulcer. Okay, now, if you do not treat the peptic ulcer itself, right, the peptic ulcer actually will progress into what they call the chronic gastritis itself. And from there itself, actually, if you look at it itself, the progression of the gastritis itself can actually lead to eventually gastric cancer, right? So therefore, H. pylori infection actually is a strong risk factor for stomach cancer. Now you look at it, right? There is a study on H. pylori causes 90% of stomach cancer, half of which actually occur in China alone. And you can see from here that there's this study. This study indicates that the number of incident cases of stomach cancer and East Asia account for more than half of the world gastric cancer cases itself. So China actually is the epicenter of gastric cancer. And gastric cancer is a very deadly disease itself. If you look at here, in the 5-year survival of gastric cancer itself, even is detected locally, is localized, actually the survival is 76%. But if you look at it itself, it is all stages combined, the survival rate of gastric cancer is actually 36%. It's one of the few very deadly cancer still currently in existence itself. So therefore, it's important from this perspective that actually before it change your gastric condition deteriorate to become cancerous itself, this is important to actually to prevent the progression of H. pylori infection and peptic ulcer. So this is the key thing from the medical health perspective itself. Preventing the progression is much more effective than treatment of the gastric cancer, because of gastric cancer itself currently is still have a very low survival rate. Okay, now what are the standard treatment for H. pylori? Right. So there is actually a very they already have standard treatment we call a standard triple therapy. This standard triple therapy basically combines the proton pump inhibitor, which is the medication that we just discussed about, is actually reducing the acid secretion plus these two antibiotics. The problem is that the current standard triple therapy has shown declining eradication rates in H. pylori in many countries due to antibiotic resistance. Now, this has become a problem. Although that we have a treatment on H. pylori, but then the current standard treatment is getting less and less effective. Now, let's look at this chart itself. Now, this chart, the top one is developing countries like China, India, right? Saudi Arabia, Thailand, including Malaysia itself. You can see the antibiotic resistance of the four very common antibiotics currently in the market itself. You can see that some of the resistance can be as high as up to 80%. So this is actually a very bad thing. That means that antibiotic is no longer effective itself. So in the developed country, the antibiotic resistance rate is not as high as the developing country, but it's still equally alarming because they are also at the average of 40%. You can see from here, Australia, US, Singapore, all actually have antibiotic resistance risk of about 40%, especially for this yellow color types of antibiotic. So henceforth, right, because of antibiotic resistant problem, right, the standard triple therapy effectiveness is truncated. So and it's a major concern because that means that you are not able to eradicate the H. pylori infection, then you are not able to contain and control and reduce the occurrence of gastric cancer because the risk factor is due to H. pylori. So probiotic actually has been also well studied in this case, and it's been accepted now that it's effective in the treatment and prevention of H. pylori itself. Right. So there's a lot of study here. Now I will, because of time, I will leave it for you to go and do a reference. But there's enough study today that probiotic is a very effective adjunctive therapy for H. pylori. You can use in combination with the treatment, or you can use as a supplemental to the treatment itself. Right. Okay. Now, what are the food that can help us in actually when we are for anti-pylori, the H. pylori effects? What are the food that's effective or we can take for us as an adjunctive treatment, right? So natural food with H. pylori, anti-H. pylori effects are actually food that rich in polyphenol. Polyphenol-rich compounds are like example broccoli, cranberry, curcumin, garlic, licorice. So these are the common herbs or food that actually rich in polyphenol, which have shown strong anti-H. pylori activity. So actually can be used effectively for people. In fact, it's a food that is actually can use as adjunctive for people who are suffering from H. pylori infection. Okay, now let's talk about the other organic indigestion, which is actually one of the major in a group of organic indigestion, which is your gut. Gut, actually, I think a lot of us will be familiar with. Actually, it's a stomach. When it occurs, when stomach content reflux into the esophagus cell. That means that basically your stomach content basically is reflux into the esophagus in the stomach cell. Now, leading to actually symptom of what we call the acid reflux symptom, that what we call. The problem is what? Is because that actually there is a lower esophagus sphincter. This is actually act as a valve in the actual esophagus side. So this valve act as a barrier. It will close down and prevent our gastric acid from refluxing. But this valve actually failed, and that means that the reflux occurred because the anti-reflux valve barrier failure, and this is actually one of the cause of the GERD itself. Right now, what happened when your acid is reflux and flow back into your esophagus? Basically, as our stomach acid is one of the most acidic what I call medium in our whole body itself. You have a very low pH of even 3, right? So that means that you actually virtually act as a very powerful medium to kill bacteria and actually dissolve a lot of things itself. But when you get reflux into your esophagus itself, actually the acid is so strong that you actually erode your lining of the esophagus, and actually you cause your condition called erosive esophagitis, right? Which is a condition whereby the lining is being actually eroded by your gastric acid itself. Over time, the erosion itself will lead to actually complication. I will explain later. But what are the symptoms of actually GERD itself? Right, typical symptoms of GERD are actually heartburn. Right, that's where you can feel that. That's a very common, typical one, heartburn. And regurgitation or sour or bitter fluid, where the sour fluid are actually coming out, and having a feeling of upper abdominal or chest discomfort itself. These are the typical symptoms. Now, for some, okay, they might experience chronic cough, hoarseness, right, and recurring laryngitis and sinuses, or worsening asthma. This is some of the condition that's because of the esophagus has been also affected itself. Now, long-term complication is that the erosive esophagitis itself can lead to another condition which is more severe. We call it Barrett's esophagus, which is actually increasing the risk of esophagus cancer. Esophagus cancer is also one of the deadly cancer currently. Okay, now you look at it itself, right? Now from this condition of your what they call the esophagus erosion, right? Actually, if it's not contained and treated itself, it will progress into esophagus cancer, which is actually this condition you can see from here. Now, the incidence of esophagus cancer, actually, if you look at it, China, if you look at this WHO reports itself, China actually have the highest incidence of esophagus cancer itself. Now, you can see from here that other than China itself, Southern Africa, Eastern Africa, and Japan are actually also one of the few epicenter of actually esophagus cancer. Now, I mentioned that esophagus cancer is also one of the very deadly cancer. It's because if you compare with that itself, you can see that the esophagus cancer, the 5-year survival for overall combined is only 22%. So it is very important also from the health context that we actually have to do prevention of the, what they call the GERD, do prevention on GERD to become, to reduce the risk of esophagus cancer. Okay, now what are the causes and risk factor for GERD itself, right? The risk factor, the trigger for GERD itself, there are many, but in here, I listed out some of the important ones, right? Due to physical and medical condition, hiatal hernia is a condition whereby there's a bulge in there. This is one of the major risk factor. But other than that, obesity, pregnancy, and delay gastric emptying condition whereby you eat too fast, eat too much, too full itself, also can trigger is a risk factor for GERD itself. Dietary trigger are large, high fat or dry or fried meal, peppermint, acidic food, alcohol, caffeinated drinks, and carbonated drinks. Lifestyle itself smoking, eating late or lying down soon after meal, or wearing tight clothing around the abdomen. Medications are calcium channel blockers. These are actually heart medication, right? This is basically a hypertension medication, right? Sedative, antidepressant. All these medication relax the valve and actually aggravate the reflux itself. So these are the risk factor for GERD. So for people who are suffering from GERD itself, do take note. There are things that you can actually modify and moderate, and the lifestyle habit, triggering, dietary trigger are the common thing that you can actually do and make a change. Okay, medication for GERD itself, right? GERD therapy actually include treatment with acid suppressive agent because they're dealing with the acid reflux itself. So short-term home therapy, you can actually use baking soda. Baking soda can be an effective form of a home remedy that help to relieve your heartburn symptom because it helps by neutralizing the stomach acid. But these are only short-term relieving action. Now for medication itself, OTC is anti-acid. So anti-acid actually is commonly used, but one problem is that it's only for short term, and excessive use of it can actually make worse. Because it can make worse on the effect. In fact, improve get the have the side effect. And the other one, a common medication like we have mentioned earlier, if you see a doctor, very often doctor will actually prescribe PPI, proton pump inhibitor itself. Right? The problem is that the long-term PPI therapy always have some health risk, and therefore it's important should be periodically reassessed by a doctor. Now in here, because GERD patients very often are on long-term medication to control the reflux itself, right? And therefore, based on what we have discussed earlier, we know that you likely to suffer from nutrient deficiency, right? And therefore, multivitamin supplementation, right? It should be considered for people who are taking PPI long term. So this is one of the recommendations for people who are suffering from GERD. You should actually consider taking multivitamin supplementation. Okay, now what are the TCM alternatives for GERD? So if you find that PPI is not working for you, or you find that it's not going to solve the problem, you can actually choose to combine TCM as an alternative or as a combination. So as far as concerned, there is a well-studied formulation from TCM we call 半虾泻心汤. In short, it's a BXD itself. 半虾泻心 decoction. Actually, there's a study also to show that actually you have efficacy to treat GERD patient itself. So you can actually use it as a single therapy, or actually you can use to combine with PPI intake itself for people who want to choose to have other options. Okay, what are the dietary therapy for gastric reflux? Now the GERD itself. Now these are important because you can see that a lot of things we do itself, the medicine is not going to solve the problem. Giving you a PPI doesn't solve your root cause of your GERD, because your GERD root cause is due to your valve barrier problem, right? So, but then stopping the secretion or reducing the gastric secretion actually is not solving your underlying cause problem. So therefore, it's not effective, and very often you need to actually adjust your lifestyle. So dietary therapy is one of the key pillars in actually managing for GERD patient, right? So one of the things is very important to note is that the irregular dietary habits, especially frequent snacking, large late night meals, are strongly associated with GERD itself. So these are actually important lifestyle changes that GERD patients should consider, right? And general guidelines include reducing overall sugar and refined carbo intake, choosing lower fat meals and lean protein sources, and avoid lying down between 2 to 3 hours after eating. What are the food that may help reduce symptom of frequency of gut? Oats, banana, ginger, and turmeric. These are the recommended food that actually can help. Okay, there are also other organic causes of it, although they are not the major types of it itself. Here, I just to let everybody have a snapshot of understanding what other medical condition that can contribute to organic dyspepsia. One of the one that's very common one is IBS. You call irritable bowel syndrome. I think everybody is probably familiar with it. This is actually a problem in the large intestine itself, right? And celiac disease basically is gluten intolerance. So it's a celiac disease is a genetic disease, but actually resulting in your gluten intolerance. This also can actually trigger your it's an organic cause of your indigestion. Another one are the hypothyroidism, Parkinson's disease, multiple sclerosis, other diseases, even pregnancy itself. Pregnancy itself, you actually can actually cause indigestion. But this, of course, the pregnancy is only a transitional state. Okay, now why indigestion is challenging to manage, and very often you find the indigestion you have, you don't resolve it. You don't resolve it. It's because, first of all, let me tell you that the symptom of functional indigestion itself very frequently overlap with gut condition and very frequently also overlap with IBS. You can see from here that the functional dyspepsia here, right? And this is the gut, and this is IBS. The overlap are tremendous. There are a lot of overlap. The problem is that the overlap can be up to 70%. So if you have an overlap of diseases together, right, it is very challenging to manage. Very, very, very challenging to manage, because you really don't know which one to attack, which one to tackle, right? So this overlap contributes to repeat consultation, multiple medications, and a high healthcare burden. And this is actually a big problem. And that's why you say that, well, even if whatever we say today, like indigestion is still a very challenging thing to resolve, right? Because there's no known sure medication, right? Medication only help to relieve the symptom, right? Okay, now when digestion is harmless and when it's serious. Now this is very important. So in the end of the day, now if you're having indigestion symptom, right? But if the symptom is occasional discomfort, right, after eating or rich meal, or mild bloating or blanching relief by some relief of exercise or standing up, walking around, then it's not something of concern. It's not concern. But if you have the following red flag symptoms, like first of all, unintentional weight loss, you have persistent vomiting or blood in vomit, you have black or tar stool, because this indicates possibly bleeding in the GI side, right? You have difficulty of pain on swallowing, or you have new onset indigestion in people over 50, for old people, and a new onset indigestion problem. Family history of upper GI malignancy, like esophagus, stomach cancer, jaundice or previous gastric surgery. So these are conditions whereby that you should seek medical advice promptly, right? When you have this condition, you should not self-treat and self-medicate. These are the red flag symptoms that indicate that there might be complication or underlying condition, that serious underlying condition that need medical attention. So, okay, now in general, just to summarize, in general, if you are suffering from indigestion, right, lifestyle measure is actually one of the option that you can always adopt, regardless of the types of indigestion you have itself. So the general recommendation for people who suffer from indigestion is first, eat smaller, slower meal, and avoid lying down soon after eating. Limit food that frequently trigger the symptom like high acid food, citrus and tomato also, right? Reduce or avoid caffeine and alcohol and stop smoking if possible. From the lifestyle side, maintain a healthy body weight, engage in regular physical activities, right? And then learn to relax. Huh? Okay, now we come to actually Atomi's product that's relevant in the context of indigestion. Obviously, you notice that we have mentioned probiotic quite a few times in many instances of indigestion cases. So here, Atomi have two probiotic products. Atomi probiotic 10 plus, which is actually the powder form, right? The strength of the Atomi probiotic 10 plus is 3 billion CFU per sachet, right? It's actually contain probiotic plus enzyme in there, right? SCI is a capsule form, right? Each capsule contains 10 billion CFU, which is 3 times the dosage of actually the sachet form, right? So therefore, as far as concerned, it doesn't have any excipient because in a small capsule form. Okay, now probiotic function is well known. I think we'll skip this portion. What we basically want to actually share with everybody is that for the 10 plus itself, the powder form itself, the application for it itself is actually for digestive health maintenance, indigestion. If you're suffering from indigestion, actually you can take the probiotic actually 1 to 3 sachets a day. If you're suffering from diarrhea, you also can use it. Eczema also can use it, and gestational diabetics also can use it. Now, for the SCI, which is a more potent, higher dosage in capsule form itself, its generally application is more for more specific, more serious condition, like what you can see from here, like gut. If you are suffering from gut, you can use it. If you're suffering from H. pylori in eradication or infection, you can take it itself, right? You are suffering from IBD, you can take it. IBS also can take it. You can see that these are all relevant, especially applicable for the organic form of dyspepsia. So for functional dyspepsia, you can use the powder form. For the organic form of dyspepsia, if you're suffering from, I think that you can actually choose to take the SCI, which is a more potent form for you. Okay, now there's another product which is actually suitable for people who suffer from functional dyspepsia, which is the Atomi honeysuckle. This honeysuckle, basically the function is that it protects the gastric mucosa membrane. So basically it protects your gastric side, so that preventing your gastric side, for example, if you have ulcer or holes, you actually try to rebuild it and protect it itself. So it's a good supplementation for people who have gastric problem. Okay, right. So another one actually we talk about is actually the enzyme. Enzyme are for people who actually have digestion, malnutrition, digestion problem. And Atomi enzyme actually are very effective and useful for people to take it as a supplementation to help in the digestion itself. Okay, now the enzyme application are also relevant for the case what we are talking about in digestion. Is that first of all, the Atomi enzyme can be used for symptoms of indigestion, bloating, fullness, GI discomfort symptom, right? It also suitable for people who are suffering from malabsorption, also for malnutrition, weight loss. So generally, if you look at it itself, enzyme is also good supplementation because it helps in your absorption as well as a relief of symptom of your indigestion. Okay, now summarize here, right? Nutrient support for malabsorption or people who suffer from indigestion. We have discussed about enzyme, probiotic, right? Now we have 3 other products here, right? One is actually these two spirulina and Power Vital Energy. they basically act as a multivitamin. Right? One is actually served as a multivitamin functional drinks. Right? The other one, spirulina, is served as a multivitamin supplement itself. So for those who can enjoy the drink, you can use it, power, vital energy. But for those who choose to actually convenient, you can actually take a capsule itself. Now, the triple protein is for people who suffer from weight loss, who malnutrition. Then you usually will recommend that you also should actually take food that's rich in protein. Okay, this is the session. I'll pass back the time to Pauline now.